You guys all set? Excellent. Well, thank you for joining us. This is an exciting day. In recent months, we've discussed more and more family care teams and how we are able to provide care now to more than 49,000 individuals. Some of the other issues that we've covered under the healthcare updates is the surgical backlogs and reducing surgical backlogs, missed appointments for people on the wait list so that they can get their appointments sooner than expected, the traveling orthopedic teams that bring healthcare to people in areas where there are challenges accessing care, updating nursing regulations to make it easier for nurses to work in Newfoundland and Labrador, financial incentives that are helping to keep healthcare professionals in the province, like the physician signing bonus program, the collective agreement with the Registered Nurses Union. All of these actions help residents who need surgery or primary care and healthcare professionals who want to work in our province. But today's announcement is arguably the most exciting healthcare action update yet. This is about providing better care to children and greater peace of mind to their parents or caregivers. We're excited to announce today that we have begun the continuous glucose monitoring pilot program for youth in Newfoundland and Labrador with type 1 diabetes. Pediatric diabetes patients in this pilot project will be provided advanced technology that will deliver blood sugar measurements every few minutes by a small sensor inserted under the skin. These measurements will be provided to other technology such as a computer or a smartphone. That way, patients, family members, and caregivers, as well as medical professionals, can monitor blood sugar levels anytime, anywhere. This is a user-friendly approach to assisting those living with type 1 diabetes. The continuous glucose monitors will signal when blood sugars are either too high or too low, so the necessary steps can be taken for the best interest of the child's health. What this means is that parents of children, especially young children, can monitor their child's blood sugar levels more easily. They can do that even when the child is at school, at soccer practice, with friends, wherever they are. Parents no longer have to check blood sugar levels by pricking the child's finger. There's a level of anxiety that comes with being a parent, and an even higher level of anxiety that comes with being a parent of a child who may have a health concern, such as type 1 diabetes. These devices mean parents can let their children be children and not have to test as frequently. It means parents can rest assured knowing their child is okay. Not all participants in the pilot project are young children. People eligible for the pilot project are primarily youth with type 1 diabetes, under the age of 18, or followed by the Pediatric diabetes program. For those whom continuous glucose monitoring is deemed medically necessary by the Pediatric diabetes team, or who are using an insulin pump with hybrid closed-loop software with the capability of connecting to a continuous glucose monitor. Obviously, you would need to have a valid MCP card. To participate, we ask individuals to email nlcgmp@easternhealth.ca and request the application package. We recognize that this is an exciting pilot project and many people will want to be part of it. We also recognize there are more people in the province with type 1 diabetes who do not meet the eligibility criteria and may want to participate in the pilot. Please know that this is a first step. We anticipate having an evaluation of the results of this project in 2024, and once we've determined the feasibility of our provincial continuous glucose monitoring program and measure the outcomes of our pediatric patients on hybrid closed-loop systems. This will help confirm next steps with continued expansion. I'll now pass it over to Dr. Power.
Thank you, Minister. My name is Dr. Heather Power. I'm a pediatric endocrinologist at the Janeway Children's Health and Rehabilitation Center and a clinical assistant professor of pediatrics at Memorial. On behalf of Newfoundland and Labrador Health Services, I'm delighted to be here today with the Minister to announce the continuous glucose monitoring pilot project. This is a fantastic day for kids and families with a child with type 1 diabetes, and is an important step in providing the best diabetes care available for our children. Through a procurement process, we've selected Dexcom and Medtronic as the manufacturers as a project. As a result, the Dexcom G6 and G7 and the Medtronic integrated Guardian sensors and standalone Guardian sensors will be eligible for financial coverage. As Minister Osborne has said, these devices take glucose measurements every couple of minutes from a little sensor that's just worn underneath the skin. They then send real-time measurements so we can see the measurements, so parents can look at it on their phone, know what their blood sugars are, have that reassurance, know if they need to act on it or not act on it. So that alone is really valuable, decreases anxiety, improves quality of life. A really exciting aspect of it, though, is when patients are also wearing a compatible insulin pump. These newest generation of pumps, when worn with their compatible sensor, can run what's called a hybrid closed-loop system. There's a little algorithm on the pump that, in response to the real-time data the pump is receiving from the continuous glucose monitor, it knows not only what the blood sugar is, but is it increasing, is it decreasing? And then the pump can autonomously either increase or decrease insulin delivery based on that information. So that helps to prevent hyperglycemia from happening. It helps to prevent hypoglycemia, or worrisome low blood sugars, from happening. So minute to minute, it improves how someone who has type 1 diabetes and wearing one of these systems feels. It's preventing low blood sugars, which are very scary and can be dangerous. And because it really helps to prevent high blood sugars, it will also really improve glycemic control over time and help to prevent long-term complications of type 1 diabetes, which is also a big source of anxiety and worry for families. We worry about it for our patients, and these systems are really showing to help with that. And I can't emphasize enough how much it's helping for our patients who are wearing it. As Minister Osborne said, people eligible are the kids who right now under 18 or who are followed by a pediatric center. We still have some over 18s that we follow for an additional year or so. It's not a big lot of expectations put on the families and kids to be part of the pilot project. It's basically the diabetes care that they're already receiving from their team. We do ask that families complete a training session before they start using the sensor. They'll have to get their A1C blood test done approximately 3 months after they start, which is a regular part of diabetes care anyway, so it's not a big expectation on the family. We're going to ask them to commit to wearing the sensor 90% of the time, so we get the best results, get the best information. And really, when we have one of these sensors, people want to wear them all the time, so that's not a big ask for people to do. We want them to use the information that they get in conjunction with their diabetes care team to make safe and effective decisions for managing the diabetes, and to make sure that they're sharing their data with the care team so that we can all together make the best decisions to help manage the diabetes. Managing diabetes, particularly in pediatrics, is a team effort. As a diabetes physician, I work with children, their caregivers, other healthcare professionals to try to provide the most effective and also least intrusive care possible for the kids. I'm personally very excited for this project because it means we have real-time data, we can make effective decisions, we can really act to achieve better diabetes control than we would have ever been able to in the past. And I think most importantly, like Minister Osborne said, it really improves the quality of life for the kids. It really improves the quality of life for the families. And it's the kids that we already have on these systems, it's making such a difference to them day to day, and also it's going to make a big difference into the future. So we're very, very excited. We look forward to updating you guys on the results when we get them next year. But for now, I'll hand it back to Mr. Osborne.
Well, thank you, Dr. Power, and we are delighted to take questions from the media.
Dr. Power, as was mentioned, there are some kids already on this program. What are you hearing from families?
I see tears of joy in clinic when families come in, when they've been put on these devices. Families tell me that the parents are sleeping through the night for the first time since their child was diagnosed. Risk of low blood sugars is a very real fear for families and kids with type 1. When they happen overnight, children can sleep right through it, right? So the only way to really know if your child is low overnight, if they're not wearing a sensor, is to be getting up overnight and checking their blood sugars. These sensors, when we're wearing them, if the blood sugar is dropping quickly or if they have a low blood sugar, alert and wake up the parents so they can get up in time to prevent the low from happening or treat it if it has happened. So people are sleeping. It's changing the conversation with our patients. It's changing the relationships within the families because it's taking away a lot of stress. When you have a kid with type 1 diabetes, a lot of your thoughts in a day are, what did my child eat? Is my child running around? Is my child going to have a low blood sugar? Is my child going to have a high blood sugar? It's estimated that people living with type 1 diabetes have an additional 70 to 100 decisions they make in a day just because of their diabetes. These sensors, and particularly when they're worn with a hybrid closed-loop system, are acting to take away some of those decisions because the pump autonomously is going to increase and decrease. We're seeing less lows, we're seeing less highs. And so it's changing the stress level in families. It's changing the amount of time a family spends discussing diabetes. One family said to me, after being newly on the system, that they had their first meal, that they sat down together as a family and did not talk about diabetes because they knew the blood sugars were okay. And then they went to bed and slept all night, which hadn't happened since their child was diagnosed. So I can't emphasize enough the impact it's having for our kids and their families.
How big a deterrence has cost been for families getting these systems until now?
Yeah, so up until the coverage, cost is expensive. So if someone is paying out of pocket directly from the company, these systems cost about $300 to $400 a month, which is a lot of money. It's a lot of money when you're a working family and you're already paying maybe for some insulin, diabetes supplies, et cetera. So prohibitive for a lot of people. Most of the people who've been on the systems up until now have good insurance, that their insurance is covering it because it really is quite expensive. The absolute biggest deterrent for people has been cost. And now we have coverage. So that's not an obstacle anymore. So it's amazing to have that.
And so then this would be at no cost to the families for this now?
That's right. It's 100% coverage. Yeah.
So, Minister, this is a pilot project. What are you going to be looking for from this to decide whether or not you expand this further or what the future looks like?
So, as Dr. Power said, this is a life changer for pediatric patients and their families. We know that this system works. We know that the technology works. We're looking at the feasibility, obviously, of this. We're looking at the clinical results and how we can expand it to a greater proportion of the population. There's about 3,500 individuals in the province with type 1 diabetes. About 10% of those are pediatric patients, 380 pediatric patients in the province. And about 58% of those are on an insulin pump. So when we look at this program, it's a minimum of 150 individuals that will benefit from the continuous glucose monitor. The aim is, we hope that anybody who's a pediatric patient with a pump, that it's deemed clinically beneficial to be on the pump, that we'll be able to provide a pump to. We won't see a pediatric patient without a pump, as we move forward. But we are looking at the clinically and the feasibility of this. This pilot program is upwards to $800,000 to put into effect. How do we expand that? Well, the results of this program will give us the details and the information and the benefit. the feasibility so that we can look at expanding to a greater percentage of the population.
You mentioned people with type 1 diabetes. What about people with type 2? Is that something that's being considered in possible expansion?
So I'm going to let the expert, Dr. Power, speak more to that, but I do know that based on evidence that those who will benefit most from this program are type 1 diabetes. We look to clinical experts and medical experts for how we introduce programs. So Dr. Power, you're probably better able to speak to this than me.
Maybe just a little bit more, because I am a pediatrician, and so we don't see very many pediatric patients with type 2, so it is out of my wheelhouse. So you'd have to ask an adult endocrinologist or someone involved in adult diabetes care to get the real answer there. It's, from what I do know, I think it's less common for patients with type 2 to be on insulin pump. If someone had type 2 and was on an insulin pump, they could absolutely benefit from this. But I just don't think it's as common. But again, you'd have to ask someone who really does a lot more type 2 care than I do to get the true answer there. Sorry.
You spoke to this a bit earlier, but can you speak to the decision to do this pilot project through pediatric patients instead of maybe first through adults?
Yeah, I'm going to let Dr. Power answer as well, but I will say here, to go back to the previous question, while the pilot is type 1 pediatric, eventually, we may get into providing CGM to type 2 where it's deemed clinically beneficial. The majority of type 2 would be adult. This program is pediatric. How did we get here? Well, if we go back to 2006, I was Minister of Health and brought in the insulin pump program. So it was an easy sell, but much of the credit for this program does go to Dr. Power. She provided a presentation to me on the benefits of the CGM for pediatric patients. Some months ago, we looked at that, evaluated, and made it part of the most recent budget cycle. So Dr. Power?
Oh, sure. As a clinician, I'd love to see everyone with type 1 have access to this, but we do have to start somewhere. And children and youth with type 1 are particularly vulnerable. Type 1 diabetes is hard to manage for anyone who has type 1 diabetes, and so I don't mean to take away from the struggles that our adult patients have, because it is difficult. It's a difficult disease to manage no matter what age you are, of course, and we absolutely recognize it. In kids, it is particularly difficult. Your sugar control depends on many things. It depends on your food intake. It depends on your physical activity level. It depends on your level of stress overall in a day even. But for kids, you can imagine if you have a little toddler and you dose insulin, you dose before you eat ideally. Good luck getting a 2-year-old to eat what you put in front of them. They might some days, other days they really might not, and that's completely normal 2-year-old behavior. And then physical activity levels in children really vary throughout the day as well. It's a beautiful sunny day outside today. I bet most of the kids in this province are outside at lunchtime running around. They're probably outside at recess time running around and getting that physical activity. If they're not wearing a sensor, if they're not on a hybrid closed loop system, to prevent a low blood sugar during that physical activity, that could be kind of spontaneous, not planned, it's weather dependent, they would either have to eat some extra sugar to keep their blood sugars up or face having a low when they're active. And this is happening at a time when they're away from their parents because they're at school. So these extra challenges with kids make it it's really hard to manage in general, but young children in particular, little toddlers, but then even school-age kids with physical activity and food intake, and teenagers, of course, it's really hard to be a teenager. We might all remember what that was like. Struggle for lots of different reasons. And so our youth with type 1 are a particularly vulnerable population within our population of people who have type 1. And so it is a good place to start. And again, but I'm hopeful for expanded coverage in the future as well.
Excellent. Well, thank you very much, folks. Thank you for joining us.